Hello, my name is Nathan Varughese. I'm a medical student at Oklahoma State University, and our research was evaluating data sharing statements in high-yield psychiatry journals. This was a systematic review. In 2019, psychiatric disorders affected 1 in 8 people globally, with their economic impact projected to reach $6 trillion by 2030. Given this high prevalence, ensuring quality psychiatry research is crucial. Data sharing can improve research by enhancing transparency, collaboration, and data utility, supporting study validation, enabling meta-analyses, and fostering informed decision-making. While challenges such as privacy concerns and regulatory variability remain, there is increasing support for data sharing in biomedical sciences, especially after the 2018 mandate by the International Committee of Medical Journal Editors requiring data sharing statements for clinical trial manuscripts. Despite progress, however, data sharing in psychiatry remains limited due to privacy laws and unclear best practices, hindering reproducibility and consistency. Given the need for accurate, up-to-date information in treating mental health disorders, expanding data sharing is crucial. To address this, we analyzed the prevalence of data sharing statements in leading psychiatric journals, examining factors that influence data sharing statement inclusion and the impact of journal policies on data sharing. This analysis provides insights into strategies for improving transparency and research quality in psychiatry. Concerning the methods, this study followed systematic review procedures for article selection and data extraction, conducting a cross-sectional analysis in accordance with PRISMA guidelines, with its protocol, data, and materials available for transparency via the Open Science Framework and approved by the Oklahoma State University Institutional Review Board. Journals were selected from the top 10 by 2023 impact factor, excluding those outside traditional psychiatry, and a Medline search was conducted for clinical studies published from 2018 to 2023, including some from 2016 and 2017 based on their earliest publication date. The criteria included original psychiatric research with new data from top 10 journals, excluding reviews and unrelated studies with blinded screenings and conflict resolution. 2 authors independently extracted data using a pilot-tested Google form, covering bibliographic details, funding, study design, and data sharing statement information, with discrepancies resolved through discussion and a third author to ensure accuracy. We conducted a thematic analysis using ChatGPT to identify 10 themes from pilot study data sharing statements, which were then assessed in the current study. We assessed data sharing by emailing authors for de-identified data with a follow-up if no response was received, and informed them it was part of a data sharing statement practicality study. Concerning the results, we have our graphs listed here, and in our conclusion, we found that despite growing support for data sharing statements in psychiatry, their inclusion varies widely across journals. Journals with mandatory data sharing policies, like the Lancet Psychiatry, show higher compliance, while others, such as the American Journal of Psychiatry, lag behind. Challenges like privacy concerns, conditional data availability, and difficulties in data organization highlight the need for clearer, more effective policies to support data sharing. We recommend expanding ICMJE guidelines to include observational studies, adopting mandatory data sharing statement policies across journals, and creating clear, universally understood data sharing guidelines addressing ethical and privacy issues. Additionally, improving researcher education and providing tools for data organization would enhance transparency and reproducibility. Widespread, consistent data sharing will require ongoing policy refinement and collaboration with stakeholders. And our references are found with the QR code, and we appreciate the OSU Medical Library for the resources and accessibility in assisting with this study.